to Healthy Life. In for Dr. Tim Johnson, I'm Dr. Lisa Thornton. These days, having a baby at age 35 or 40 isn't that unusual, but it does lead to increased risk of birth defects and infertility. What if a woman could freeze her eggs when she was young and healthy and save them until she wanted to have them later, a baby later in life? Joining me today is Dr. Carleen Elsner. She's a reproductive endocrinologist at Reproductive Biology Associates, and she's involved in developing a treatment that would allow women to do just that. Dr. Elsner, freezing embryos has actually been around for almost 30 years now with test tube babies. Can you briefly talk about what that involves?
Well, it's very simple. A woman is stimulated with drugs. She then undergoes very careful monitoring and an egg retrieval. Egg retrievals are technically not surgical. They're not surgical. And they allow us to recover a lot of eggs, which are then inseminated, and they may fertilize and produce embryos.
So insemination, we should let our viewers know that insemination means that the sperm and the egg are put together outside of the woman's body.
Yes, that is correct. The embryos are then produced, and they can either be used, but frequently there are too many embryos to be used at that one point. So additional extra embryos are frozen for later use.
How is what you're doing different from that?
Well, we're talking about freezing eggs. That is unfertilized eggs before the embryo is created. This way, it provides a number of advantages for women. First of all, there is no need to create a large number of potentially unwanted embryos. Another thing it allows to do is patients who are cancer patients can actually preserve eggs for use after their cancer treatment is done and they're healthy again, and it allows them potentially to have a family. It's also wonderful technology for women who need to use donor eggs. Eggs, they're older, they can't produce their own eggs, so they need to use donated eggs from a younger woman. This makes that technology much less expensive, much easier, much more available, with less wait time for them.
I want to be sure our viewers are clear that an embryo is an egg and a sperm put together.
Yes.
And then allowed to divide a little bit and frozen for later use.
An embryo
and what you're
is a fertilized egg. Men produce sperm, women produce eggs. When these come together, they make embryos. They can be frozen at three different stages. They can be frozen before they divide at the 2-pronucleate stage where it's one cell, or they can be frozen at later stages of development.
Now, this has actually led to a lot of moral and ethical debate, these frozen embryos and what to do with them.
Absolutely.
So with just harvesting eggs and freezing them, do you think this will lead to similar moral and ethical problems?
I am hoping that this will resolve some of the moral and ethical problems that we are having. After all, sperm banking has been around for many years. Technically speaking, egg banking has not been possible previously, but certainly I think it's becoming possible now.
What type of women, other than women who are having cancer chemotherapy or radiation where they're really at risk and they know they're going to probably be infertile after their treatments, do you perceive like young 21 and 25-year-old women using this technique in the future?
Well, you never can say what's going to happen in the future, but I think there is the possibility that ultimately that will be possible. At this moment, the American Society of Reproductive Medicine is not advocating this technology for fertility preservation. But I think as we get more experience with it, there is that possibility down the line.
Is this technique being used anywhere outside of a laboratory right now?
Well, it obviously requires IVF technology to do this, so it has to be done in a laboratory. It has been investigational up until now, but I think that you're going to find that egg banks are going to become a reality. This technology is practical, particularly for women who need to use donor eggs in order to conceive. And I think you stay tuned for the next 6 months or a year and you're going to see it's happening, it's practical, and it's wonderful. It's very empowering technology for women. The reason
it certainly is.
The reason is it allows them the freedom to have the family that they want at a time that's right for them and without the need to create all these unused extra spare embryos that are frozen.
Absolutely. It's so exciting. We will wait and watch with you and hope that we do see this in the future. Thank you so much for joining us, Dr. Elsner.
Thank you very much.